Hi everybody, this is Dr. David Ross at the Virginia Institute of Neuropsychiatry, and I want to talk to you today about the definition of traumatic brain injury. Traumatic brain injury, unfortunately, is relatively common, and although many patients fully recover, there are a substantial number of patients who have chronic symptoms which can last for months, years, in some cases even the rest of their lives. So how do you define traumatic brain injury? Well, this is my favorite definition by Dr. Menon and colleagues, and it says that a traumatic brain injury is an alteration of brain function or other evidence of brain pathology caused by an external force. And so I want to break this apart for you to tell you how to define and diagnose traumatic brain injury. Let's start with the part caused by an external force. Now, this can be an impact to the head or an acceleration of the head. Most people, when they think about traumatic brain injury, think about maybe hitting a steering wheel, or object hits your head, or in football, your head hits the other football player's head, things like that. And those direct impacts to the head certainly can cause traumatic brain injuries. But you can also get a traumatic brain injury just by having your head whip back and forth, like a whiplash type of injury that you can get in a car accident or other things. And you don't even necessarily have to hit your head. You don't have to necessarily have any direct impact. Just the shaking of your head back and forth can be enough to cause a traumatic brain injury sometimes. The other part of this definition is that there must be an alteration in brain function. And this is defined a little bit more specifically by being at least one of the following: loss of consciousness, altered consciousness, amnesia, and focal neurological deficit. And I'll tell you a little bit about each of these. So if your impact to the head or acceleration of the head is followed by, let's start with loss of consciousness. I think most people know what that means. That means you are unresponsive. Someone shakes you, calls your name, you don't respond. What's the difference between being asleep and being unconscious? Well, when you're asleep, you can wake someone up, even from a deep sleep. You shake them a little bit, call their name, they'll wake up, and they may be sleepy, but they're not going to be completely unresponsive like you would be if you had lost consciousness. Next thing is altered consciousness. That can be if you are disoriented, confused, dazed, or stunned. For example, after hitting your head, if you don't know who you are or who other people are or where you are or what is the situation around you, those would be signs of altered consciousness. Then we have amnesia, which means basically a complete loss of memory or an almost complete loss of memory that can occur for the events immediately following the traumatic brain injury, or it can affect memories just before the traumatic brain injury. That's also common. And because the amnesia occurs as a result of the traumatic brain injury, we often call it post-traumatic amnesia. And finally, we have focal neurological deficits. These could include things like not being able to speak clearly, not being able to move an arm or move a leg. One of the most common focal neurological deficits I see in my type of patients, and we have a lot of car accident patients or slip and fall at work, things like that. And one of the most common focal neurological deficits we see is when you see stars, which is usually due to impact to the back of your head, the occipital lobe back there, which controls visual perception. So if you have a significant impact to your head or acceleration of your head, followed by at least one of these four things, then by definition, you had a traumatic brain injury. Now, what's a concussion? Another term that most people have heard of, and that it's a little bit of confusion here. But basically, concussion means traumatic brain injury. And if you remember that, you'll remember about 99% of what you need to know about concussion. Concussion is a term which arose mainly from the sports literature, and traumatic brain injury is a term which mainly arose from the medical literature. Traumatic brain injury has a very clear and specific definition, which is the one I just gave you. Concussion tends to be a little bit more loosely defined. Some people define it a little bit more this way, and other people define it a little bit more that way. Some people might say it's a traumatic brain injury within a sports setting. Some people might say it's a mild traumatic brain injury. And that's because in sports, usually the forces that affect your head and brain tend to be much smaller than something like a car accident where maybe a big truck hits your vehicle. So traumatic brain injuries in a sports setting usually are mild, often very mild to mild, although they can occasionally be moderate or even severe uncommonly. So yeah, concussion usually is mild, but not necessarily. And that's why it's a little bit fuzzy. So I usually prefer the term traumatic brain injury because it has a clear medical definition, but I will sometimes use the word concussion when I'm talking about traumatic brain injuries in a sports context. And so I hope this helps you understand what is a traumatic brain injury. And if you have more questions, feel free to contact us at the Virginia Institute of Neuropsychiatry. Thank you.